the most common answer I receive about their diet is their binge eating, late night snacking, and oily food consumption. In the process of doing a healthy diet in the daytime, they end up eating a lot of unhealthy food in the night. Let us understand what is fatty liver. Fatty liver is a condition where there is excess buildup of fat within the liver. Generally, there is about 5 to 10% of fat that's already present in the liver. But when it exceeds this percentage, it converts into fatty liver disease. You know, about 39 to 40% of Indian adults suffer with fatty liver disease. Usually, there's some amount of fat that is always present in the liver. There is two types of fatty liver disease. The most commonly known is the alcoholic fatty liver disease. But the other one, which is known as non-alcoholic fatty liver disease, is also the more common and silently arising one. This is associated with metabolic conditions and sedentary lifestyle, so much so that it has been renamed to something known as MASH, metabolically associated steatohepatitis. Why does fatty liver happen? Usually it is due to the unhealthy diet, which also includes refined fats and sugars and excessive oily fried food intake. It can also be due to lack of physical activity or a sedentary lifestyle. When I interact with my patients in an everyday clinical setting, the most common answer I receive about their diet is their binge eating, late night snacking, and oily food consumption. In the process of doing a healthy diet in the daytime, they end up eating a lot of unhealthy food in the night. So now let us understand the risk factors that are also contributing towards fatty liver disease. It is obesity. Visceral fat, as we discussed earlier, having too much of visceral fat can lead to fatty liver disease as well. Other conditions like diabetes, high cholesterol levels can also silently contribute towards fatty liver disease. What are the symptoms, you may ask? Usually it is asymptomatic. In the early stage, you will not know that you have fatty liver disease. It's only mild conditions such as fatigue or exhaustion and upper right abdominal pain, mild pain at that you would be feeling. So how do we detect fatty liver disease? Usually it is through few tests. One is your blood test, which includes your liver enzyme testing. Then you can do an ultrasound of the abdomen, or advanced tests like CTs could also be required in certain conditions. The good news is that fatty liver is reversible, especially when it is in the early stages. So what you can do about it is try losing weight. About 5 to 10% of body weight loss can help you tremendously. Next, there is exercise, about 30 to 45 minutes of exercise daily for at least 5 days a week. This has shown to help with fatty liver reversal. And try to avoid refined carbs, sugars, and fried fatty food consumption. Other lifestyle advice would be to control alcohol consumption and control metabolic disorders such as high cholesterol levels, visceral fat, and diabetes. Your liver is very forgiving. So if you start taking care of it early, it will heal completely. So let us start taking care of it.